Hello, Dr. McMahon. My name is Mary Wider, and I've been in quite a few of your classes over the last 2.5 years here at Ashford University. And I decided to do the webcam recording just because it's kind of nice to put a face with a name. And I've been in a bunch of your classes, so I figured maybe it'd be good for you to actually see what I look like after all this. And being that I'm wrapping it up here at Ashford finally after all this time. Thank you so much for all of your leading and your teachings, and really enjoyed a lot of your classes. They've been really interesting. I've learned so much, and actually this isn't the end of my educational adventure. I'm going to keep going actually. But thank you again for everything. It's really prepared me to keep moving on with my career. So I hope you don't mind that I'm doing a web cam recording as well with this. So I apologize if I keep looking down at my notes that I've taken for the interview questions. So just a little brief little thing. I just actually had an interview, and I have another one coming up. Well, the first one was for quality assurance manager at the hospital that I work at. And I did not get that job. Actually, they offered it to somebody else, but I do have another interview coming up for a clinical admissions coordinator position at the hospital that I'm working at, and I'm really excited about it. And I think I wish I would have taken this class when I did the first interview, because now that I look back, I should have studied more questions. I should have been a little more prepared. It was the first job interview I've had in, 18 years. Because I've been a PT assistant for the last 18 years, I really haven't had to have any job interviews. So, but now that I'm wanting to expand my career, I forgot how important it is to really prepare not only your knowledge of what the job is, but how to answer questions. Because a lot of times interviewers don't ask questions about the job itself, but ask you more about yourself. And wanting to know what kind of person you are, and will ask questions accordingly. So after looking at the really long list of questions that you had given us about potential interview questions, I picked these 7. So the first question I chose was, why do you want to work in this industry? And actually the interview I went to did ask me this question. They asked, why do you want this job? So why do you want to work in this industry? So my answer to that in an interview would be, and it's quite simple actually, and I feel like healthcare has always been my passion. It's always been my passion to help people and to learn more, not only about us as humans and our health and our wellness, but how can I help more? What can I do to do more? So, and I've done so much already in my career as far as helping people regain their lives, regain their independence. And now I want to take it even further and get into more the workings of healthcare, to be able to get into the nitty gritty of how this all works and how this all comes together. So working in the position that I'm applying for the clinical admissions coordinator, that helps me. I get to go out and be the one to say, yes, we've looked at all of your information. I've looked at your medical history, and I've determined that you are appropriate to come to our facility for rehab. So that is why I want to work in this industry. The second question, which has a lot of different answers, I think, was, how do you stay current in the healthcare profession? And I think it's really important. I think a lot of us take for granted the expansive knowledge that we all have as clinicians and practitioners. Yes, we have a great base of knowledge, but things are always changing. Things are always expanding. There's more research being done. There's new treatments being offered that now have a clinical evidence base to them. And I feel like it's more important to make sure you stay current on those things. And it's important to do research. It's important to do your reading. It's important to connect with other healthcare practitioners to really stay on top of what's the most current. So in my professional experience, what I've done is take what my current employer offers me and try to use that to the best of my knowledge. So currently, my employer offers us continuing education courses for free. They've paid for a subscription to a continuing education website that allows us to do webinars, allows us to take classes on a variety of different topics. I've taken topics that are physical therapy based, but I've also taken classes that are also healthcare management based, quality measures, Medicare, Medicaid background, or policies and procedures, what their regulations are, things like that. So I think you have to really be motivated to learn and to want to expand your knowledge in all these areas, because it's not just what we already know. Like we know what we know, so now we need to take that a step further and be like, how can I be a better practitioner? How can I be a better professional? And keep learning and keep learning. So when that is not offered to me, there are so many resources out there that are available to healthcare practitioners that are free. You don't necessarily have to pay for continuing education in order to receive continuing education. You just need to look for it. So, and I've already explored a lot of professional websites. There's even things on LinkedIn where you can get links to webinars, to TED TV, stuff like that, where you can really gain some more knowledge. So my third question is, what experience do I have with training and presentations? And actually, in the 18 years that I've been a PT assistant, I've done a lot of training and presentations. First, I've done, every month I do new employee orientation for the hospital that I work for. My topic is disability sensitivity. So every month I have new CNAs, new management, new nurses that are coming into the facility, and my job is to teach them, to train them what it's like to be sensitive to somebody with disabilities, to have empathy, to be able to care for people that have disabilities, to be able to feel what they feel every day. I've also been offered a annual presentation at St. John Fisher College, which is a local institution here, a very excellent college, where they've actually asked me, they invited me personally to come and give a presentation once a year to their pharmacy students on what physical therapy is in the long-term care setting, what it means to be an interdisciplinary team, and discuss what their role is in long-term care facility, what their role is in our team there. So I have a lot of training and presentation experience, talking to a vast variety of people with different educational backgrounds, different sorts of professionals. So I do have quite an extensive training experience. So my next question is, what would your coworkers say about you as an employee? And I chose this question because I really do pride myself on my work ethic. And I think if I had to choose one thing that my coworkers over the last 14 years at Monroe Community Hospital would say about me, is that I have a very strong work ethic. I work very hard. I work from the moment I get in the door to the moment I leave. And I'm willing to be a team player. I am willing to help out others when they need help. I'm willing to go the extra mile for not just my coworkers, but for my patients and clients that I work with as well. So I would hope that that's one of the biggest things that they would say about me. My fifth question is, how does this organization benefit by hiring you? Actually, when I went for my interview for the quality manager position, they did ask me this question, like, why should we hire you as opposed to hiring somebody else for this position? And the thing that I took from that, and because I'm applying for a position that is already at the facility that I work at, my biggest thing is that I am invested in the place that I work in. And I feel like I believe in this organization. I have a ton of motivation to make this facility better, to make it be what it should be, or what it needs to be. So I feel like, given that I am so invested in what this facility stands for, that I would be an excellent candidate for this position. I have nothing but hard work and motivation to bring to the table. So number 6, could you give an example of when you led a project from start to finish? So I wasn't quite sure if this was meant to like a group project, but I did have a project that I worked on independently. 2 years ago, I had come to a point in my career where I felt like I was very frustrated with dealing with Medicare and Medicaid guidelines as far as ordering medical equipment for the patients that I serve. So patients that leave the facility and go back into the community sometimes have equipment needs, be it a power wheelchair, maybe they need a hospital bed at home, maybe they need a manual wheelchair at home, maybe they need some sort of other assistive device. And I was finding myself very frustrated with trying to give the patients that I serve the things they need in order to be successful in the community and independent in the community. So what I did was I approached the medical staff, actually, and wanted to participate in their grand rounds that they have once a month at the facility. They have them every Wednesday, and it's usually doctors that give these presentations, and it's in a variety of medical diagnoses and pathologies and things like that. But I really felt like I wanted to present to not only the other therapists in the facility, but to the medical staff in the facility, because we needed their help as well in meeting these regulations so that I can safely discharge a patient home with the equipment that I recommend. And I need the medical staff to be able to be on board with all of that. So what I did was I approached the medical team and asked if I could also be a part of medical grand rounds. And I wanted to give a presentation on Medicare's guidelines on durable medical equipment, what's covered, what's not covered, what the medical team needs to do in order to help facilitate dispersing and ordering this equipment. So it took me probably 6 months to get this from start to finish, from organizing with the medical staff when I was going to do this, to interviewing durable medical equipment vendors, to coming up with a written presentation, to researching Medicare and Medicaid guidelines online, and then putting it all together and presenting it to the medical grand rounds, which was very successful. And actually, they've asked me to come back a couple times, but because actually Medicare guidelines keep changing so much, I have not been back to do the presentation again. But I actually would really like to do it again, just so, because the medical staff is always changing, it's always good to give an update and to educate the new medical staff that's coming in what they can do to help us out. So that's one of my most proud accomplishments that I've ever had, was being able to talk in front of community physicians. Me as a physical therapist assistant, having an associate's degree at the time, now lecturing to an audience of community physicians and other highly educated medical professionals. It was one of my greatest accomplishments I think I've ever had. So the last and final question is, do you feel that you have accomplished what you set out to do at this point? Yes and no. I think it's a yes and no question. Yes, I am where I would like to be right now, and professionally and academically. At this point now, I am where I would like to be, and that's why I'm pursuing a different position. I love my job as a physical therapist assistant. I love working with patients, but I also